There is some breaking news tonight on the COVID-19 front in this country. First of all, Air Canada has now confirmed that one of its passengers who flew from Montreal to Vancouver on February 14th has tested positive for the virus. The BC Centre for Disease Control is said to be following up with passengers from that flight. And Ontario officials say there's a new presumptive case in Toronto, a woman who arrived from China on Friday. She is in self-isolation. The province says she wore a mask on her travels back to Toronto. As China and the world works to contain the deadly spread of COVID-19, cases continue to rise. And now there's a fear the incubation period is actually much longer than first thought. The Chinese government confirmed today that a 70-year-old man didn't show symptoms of the virus until 27 days later. Around the globe, more than 78,000 people are infected and more than 2,000 have died, mostly in mainland China. But the virus is spreading fast. Numbers are rising in Japan, and there's a red alert in South Korea after a sixth person died. Countries in the Middle East are closing borders to Iran, which recorded 15 new cases today and 3 more deaths. And in Europe, Austria suspended all trains to and from Italy as cases in Italy surge. Until more about the incubation period is known, it's not yet known if 151 Canadians will now have to spend more time in quarantine in Cornwall, Ontario. But as Heather Yourex-West reports, Canadian health officials are adjusting their strategy as hope of containing the virus begins to fade.
Several communities in Italy are now under lockdown after what began as just 3 cases Friday soared to more than 150 by Sunday afternoon. In Iran, dozens of sick and at least 8 dead have prompted a number of neighboring countries, including Pakistan, to close their borders. And in South Korea, where infections have now soared past 600, officials have declared a red alert.
The leaders in the World Health Organization have really talked about this closing window of opportunity to contain the virus in China. But it appears that if this window truly is closing, it's almost nearly closed, or it has closed.
On Sunday, China's president acknowledged shortcomings in his government's response to the outbreak, calling the situation in China still grim and complex. China's efforts to stop this virus from causing a worldwide pandemic appear to be failing. On Twitter, Canada's chief public health officer says this country needs to do more now. Dr. Theresa Tam wrote, "It is prudent to ramp up our planning and preparations in the case of a more widespread outbreak. The risk to Canadians has not changed, but we must plan for all scenarios."
Certainly at a health systems level, we can increase the capacity to do diagnostic testing and really increase supports to hospitals and healthcare systems to really accommodate for perhaps an influx in the number of patients.
Especially as patients could arrive in our country now from any number of countries beyond China. Canada's latest presumed case arrived in BC from Iran. The risk for most Canadians remains low for now, but as the world reaches a tipping point on this coronavirus outbreak, health officials know that could change at any time. Heather Yourex-West, Global News, Calgary.